Hello, and welcome to Meet the Cartoonist, Josh Neufeld. My name is Diane, and I'll be facilitating tonight's program, while my colleague Jessica will be monitoring the group chat. Okay, and now I am very happy to introduce tonight's speaker. Josh Neufeld creates non-fiction journalistic comics to give voice to stories that wouldn't otherwise be heard. He's the writer-artist of the best-selling non-fiction graphic novel, A.D. New Orleans After the Deluge. In addition, he's the illustrator of the bestseller, The Influencing Machine, Brooke Gladstone on the Media. His journalistic comic stories have been published by Columbia Journalism Review, Foreign Policy Magazine, the Chicago Sun-Times, the Boston Globe, the Nib, Medium, Al Jazeera America, and The Emancipator, among others. Neufeld has been a Knight Wallace Fellow in Journalism, an Atlantic Center for the Arts Master Artist, and a Xerox Award winner. A faculty member of the School of Visual Arts, Neufeld has also taught comics and programs in the United States and abroad. And you can find more information about him at joshcomics.com. And now, I'm happy to turn it over to Josh.
Well, thank you, Diane, for that very nice and thorough introduction. And thanks to the Johnson County Library for hosting me. I'm excited to take part this week in the various events. And today I'll talk about my own work and career. And then tomorrow I'll do a workshop on writing for comics, and Saturday a longer workshop on making your own nonfiction comics, which I encourage everyone to do, even if you've never drawn a comic before. It's fun and easy to do. So let me jump in and start talking about my own work. I will do that by moving over to the media player and start off with just a little display of some covers of works that I've done, which I'll talk a little bit about some of those in the course of the evening. And I'm just going to zoom through a bunch of slides pretty quickly and read some of them out loud to you, and others I'll talk over. So if anyone feels like I'm going too quickly, or if they have a question, feel free to put something in the Q&A, and I'll try to keep an eye on that and interject any answers or adjust things as needed. So my comics career started out, it's been a long and winding road. It started out different subjects and styles. Like I initially drew superhero comics back in the day, not very successfully or with much enjoyment. So then I moved on to doing memoir and autobiography. I did my own works of memoir, and then I illustrated other people's nonfiction comics, including Harvey Pekar of American Splendor. And now I pretty much focus on stories of other people and events. And I've published 3 books, which Diane mentioned, 2 of which were New York Times bestsellers, and they're both in multiple printings. And my short comics pieces have appeared in a number of different publications and websites. And I've been nominated for various awards like the Ignatz, the Eisner, the Harvey. These are all like specific awards within the comics community. And where did it all start, though? I thought it'd be kind of fun to take you through my career by actually sharing a selection of stories with you. It all started when I was a kid, growing up in interesting circumstances, first in Southern California, then in San Francisco, and finally in New York, which is where I live now. So I've been back and forth to New York many times over the years as I've been an adult. So just to give you a taste of how I approach doing nonfiction comics, this is a piece I did about that early period of my life. This is the full page view, just to kind of show you how the comic would look on a page in a typical comic book or graphic novel. But I'm going to break it down panel by panel to make it easier to share on screen. So this is about me growing up with my single mother, mom, and the various father figures who appeared throughout my life that I gravitated towards or was stuck with, depending on the case may be. So let's go through it. As I was growing up, basically raised by my mom, a lot of men passed through my life, father figures. Age 2, dad takes off. I just don't think I'm cut out to be a father. Age 3, unclear on the concept. Dada? Holding up a piece of celery. This is a story my mom tells, that I held up a piece of celery when I was 3 and I said, Dada? I didn't have a dad. Kind of interesting. Confusion there. Age 4 to 5, Reuben, a doctor who liked my mom and my drawings. There's a little self-portrait of me as a cowboy with another person, not sure who that's supposed to be. Age 6, my dad came back for a visit. He scared the cat. Hello, I'm your father. Wow. Age 7, Daniel. He jumped our car battery, asked for my mom's number, which I shouted out. I don't know if my mom was so thrilled about that, but he did take us out to a nice meal. Ages 7 to 11, Alan. Argued with my mom about Karl Marx over dinner. Age 8, my dad came back, this time with wife number 2. He took me in for about a year. He bought me comics, he removed a splinter, took me to see Blazing Saddles. Life was good. Ages 9 to 11, back with my mom, Austin and Paul, housemates in our shared living situation. They took me to the beach, they played pranks, they treated me like their little brother. I see, said the blind man. That was Austin's favorite funny little aphorism. Ages 9 to 11, Phil, our other housemate, tapped his cereal down below the milk, used ketchup and mayo to make smiley faces on his burger patties. Age 9 to 13, my dad, for a month each summer, fed me steak and chicken, taught me to play baseball. That's it, keep your eye on the ball. 11 to 13, Bob, took me to Candlestick Park, championed Little League, barber haircuts, Adidas sneakers, a little more mainstream than most of my mom's previous boyfriends. Age 13, Michael, a grad student who hung around for a while. Age 14 to 17, Dad, with wife number 3 and a new baby, took me in for high school. Age 14 to 20, Hawkeye. Any MASH fans out there? Cracked wise, yet able to cry, loved and respected women. My kidneys were expecting orange juice, silly kidneys. Age 14 to 21, John, came with a dog and a country house, taught me to play squash. There you go, keep your eye on the ball. Age 40, that's when I did this comic. Josh, let's see. The equation is dad to the 5th divided by wives squared plus mom divided by boyfriends to the 7th times dog plus housemates to the 3rd divided by baseball plus comics times celery plus steak times Blazing Saddles plus MASH equals me, because I became a dad. That little girl who's 10 months old there is now 15 years old. But that's father figures. So moving on, during that whole period, and you got a little taste of some of the things you can do with nonfiction comics. I was a young artist, obsessed with comics. And one of my biggest influences was Hergé, also known as Georges Remy, the Belgian cartoonist who created Tintin. And Tintin's a little more well-known now here in the US than he was back when I was growing up. It was pretty unusual for someone my age to be reading, in America, to be reading Tintin comics, but my mom, who was an artist, would always bring me back a Tintin comic from wherever she was traveling. She would always find an English translation of one. And so those were the comics that I grew up reading, mostly because she also didn't really approve of superhero comics with all the violence and guns and stuff. So Tintin was a big influence on me, so much so. Oh, the other thing you need to know is around the time when I made this next comic, I was starting to do memoir comics of my own, mostly about my youthful around the world backpacking misadventures with my then girlfriend, now my wife. And I collected those in this book, A Few Perfect Hours. So this is the kind of stuff I was doing as a kid. where I really emulated Hergé and Tintin to the point where I made this funny little comic where basically where Hergé and Tintin accused me of plagiarizing them. Case number 714, Georges Remy versus Josh Neufeld. So remember, Georges Remy is the real name of Hergé, the pen name Hergé. So let's find out about what happens in this. For the prosecution, Tintin, thank you. We will prove that the accused, Mr. Neufeld, has willfully and recklessly imitated the plaintiff's art style and characters, an activity that Mr. Neufeld has engaged in for 25 years. As the star of more than 20 Georges Remy Hergé adventures, I can spot a doppelganger easily. Mr. Neufeld clearly intended to steal my identity when, at age 10, he created his hero, Tim. There's one of my drawings from when I was about 10. Next witness, Snowy. As Tintin's cute canine companion, I quickly sniffed out my counterfeit counterpart. Grr, woof. So I made Tim instead of Tintin, and I made Harry instead of Snowy. Looks like basically the same type of dog, little white dog. Captain Haddock. I'm Tintin's curmudgeonly alcoholic sidekick. This bashy bazook Captain Raid is just a cheap imposter. You're not wrong. Here we see Tim and Harry in action. A crude attempt to be sure, but the intent is clear. This scene is almost identical to one from pages 42 to 43 of the 1948 classic The Seven Crystal Balls. My comic was Tim and Harry versus the computer crook. Now we move to the present. Not content with his youthful indiscretions, Mr. Neufeld plagiarized the very essence of Hergé's work by creating a series of autobiographical travel adventures. As you can see here, these are no more than thinly veiled attempts at revisiting the excitement of such classic stories as Prisoners of the Sun and the Black Island. In fact, I would go so far as to claim that the very reason Mr. Neufeld went backpacking around the world in the first place was some kind of misguided desire to experience my adventures for himself. Yeah, my travel stories originated in a comic called Keyhole. And what does the defense have to say? So here we zoom in on a shot of me at the drawing table. I deny everything. The prosecution rests. So you get it. I have one of those funny little hair things, like a quiff, like Tintin. So yeah, you know. Okay, you see where I'm going with this. All right, so moving along, the next phase of my career after I went through the autobiography phase was as a comics journalist. People often ask how I get my stories. Well, the same way other journalists do. For my book on New Orleans and Hurricane Katrina, I went down to the region on 9 separate occasions over a 4-year period. I interviewed my subjects in person, made lots of sketches, took tons of photos, and performed hours of research. True to its name, I just want to clarify what is comics journalism. It's journalism using the form of comics. So the characters I portray are real people, and the text in their word balloons are actual quotes from my interviews with them. The book that probably most people know my work the best, AD New Orleans After the Deluge. This is just a quick overview of sort of the characters and scenarios of it. So Leo McGovern lived in the Mid-City section of New Orleans, evacuating to Houston the day before the hurricane struck. Leo and his girlfriend lost all of their possessions, including Leo's huge collection of comic books and graphic novels. Kwame Webster is from New Orleans East. A high school student and pastor's son, he evacuated with his family and watched the disaster unfold on TV. Kwame lost everything in the flood and was forced to finish high school in Berkeley, California. He didn't return home for many years. Hamid Mohammadi lived in Uptown. Hamid and his fishing buddy Mansell stayed behind to watch over Hamid's family-run supermarket, the Calhoun Superette, and protect it from the threat of looters. The two men were forced to shelter on the roof of the Superette's tool shed for 2 days. You can see the whole area was flooded around there. And then there's Dr. Brobson Lutz of the French Quarter. Dr. Lutz sheltered some friends at his home, which was untouched by the storm. As the days passed, the doctor, a specialist in internal medicine, helped set up an impromptu street clinic. And finally, Denise Moore, who lived in Central City. Despite warnings to evacuate, Denise stayed behind with her mother, a surgical tech at Memorial Baptist Hospital. The storm hit her apartment building hard. Worse was the 3 days she and her family spent at the New Orleans Convention Center, with thousands of others seeking shelter there who essentially had been abandoned to their fate. And here we see a scene from when she was at the convention center. How can this be happening? Don't the authorities know about us? Don't they care? Denise lost everything in the storm's aftermath. So that's just a quick overview of the scenario of the characters in the book, which traces their lives from before the hurricane, through it, their evacuations, if they stayed behind, coming back to the city and rebuilding their lives. And that was published back in 2009. And these are the characters again. We have Leo and Michelle and Denise and the doctor and Kwame and Hamid. But again, I just want to make it clear and remind everyone that these are all real people. So for some folks, it's still kind of surprising to learn that, a comic can actually be about real people and not be fictional. So I always like to show this picture just to remind people that these were all real. They're not characters that I made up. They're not composites. They're real people whose stories that I told. But not all the stuff I do in comics journalism form is necessarily like super serious and filled with trauma. This was a piece I did some years back about emojis and sort of what the origin of those little phone pictures that we now use all the time on our phone. This was published in the Boston Globe. I'm going to split it up again so we can kind of get a real in-depth look at it. It's called The Secret Life of Emojis. Newsflash, the world loves emojis. Emojis can effectively convey feeling, but they can also be confusing. When Twitter changed its bookmarking icons last fall, it inspired a lot of debate. Well, Twitter inspires a lot of debate up until now, but this was way back 5 years ago, 6 years ago. This was a big deal. I don't know if folks remember, but they got rid of the star and replaced it with the heart for when you like a tweet. Big deal. After all, the star and the heart aren't equivalent, which one means acknowledgement, which one means approval. Given their lineage, it's not surprising that some emojis are confusing and are often misinterpreted. Emojis originated in Japan, inspired by both kanji, Japanese characters, and manga, Japanese comics. Besides being read from right to left, manga, as well as anime, Japanese cartoons, employ iconography that can be confusing to Western readers. So this, which is a common image that you would see in manga, looks like somebody lying down with a bubble coming out of their nose, actually means this: somebody sleeping. And that's why this emoji means I'm sleepy, not fighting a cold. Not what we would associate with being sleepy here in the West. But would you have guessed that I feel triumphant, not frustrated? Tell that to an angry bull. So yeah, this emoji, coming again from Japanese manga iconography, when you have these like puffs coming out of your nose, is to show that you are feeling triumphant. And this one, does this mean victory or peace or just the number 2? In England, if you turn it around, you may get punched. That's a bad symbol. It's like the middle finger in England. And how about this one? Am I a pair of praying hands or a high five? The rapper Drake had very strong feelings about this. He wrote, I pity the fool who high fives in 2014. I think it's still happening, Drake, sorry. And just to be clear, I'm tired, not horrified. Yes, the horrified cat emoji actually is showing that it's tired, not horrified. How many of us use that one correctly? You may already know that in Japan, I'm considered good luck, but I've seen others using me differently. I'm the world's #1 most popular emoji and last year's Oxford Dictionary's Word of the Year. I'm so proud. Da-dum-dum, boom. So there you go. Not, like I said, not all of these are necessarily super serious, and they can be lighthearted, and you can learn at the same time. Comics can be fun and educational. But turning to maybe a slightly more serious topic, I think definitely more serious topic. This is a comic that I did, a journalistic comic about during COVID. I did this in the summer of 2020, and it's called Supply Chain Superhero. And again, I just want to show you, this is what the comic would look like with all the panels together and linked together in a natural way with a certain flow and a certain number of panels on a page that lead you across the page and into the next page. I always feel it's important to show people kind of like what, to remind people the way panels fit together on a page. But I'm going to break it up so that we can read it individually. So let's cast your mind back to the late spring of 2020. Probably most of us don't want to, but anyway, hopefully this story is interesting. We've all seen lots of stories about the heroic healthcare workers on the front lines of the COVID-19 crisis, but the doctors and nurses aren't the only ones in the hospitals. We don't hear much about the janitors who clean up the operating rooms, or the hospital cafeteria staff, or the people who work behind the scenes to get the medical center their equipment. This is that story, and one of one very stressful day at a New York City hospital in the midst of the pandemic. Supply Chain Superhero. Jake Neufeld, my brother, is the Enterprise Resiliency Manager of Memorial Sloan Kettering, MSK, one of the world's preeminent cancer hospitals. My team talks to the other hospitals, to trade organizations, to government agencies. I help the supply chain team manage disruptions. As a cancer hospital, MSK didn't get sent any COVID-19 patients, but they got hit hard by the virus nonetheless. At any one day, the network had over 1,000 doctors, nurses, administrators, and other employees who were out sick. Between March and June, about 400 of our cancer inpatients ended up getting COVID. About 70 of them died. And like every other hospital in New York City, MSK wasn't prepared for the PPE issue. For one thing, there's no room to store anything. When Governor Cuomo says in the future we need to have 90 days worth of supplies, that's essentially meaningless. We're a high-rise in New York City. You have to remember, pre-COVID, the hospital would go through 40 to 50,000 N95 masks per week. They were used and tossed aside with regularity. People didn't think twice about them. And then they became like gold. Jake's worst day, March 26, 2020, 5,021 COVID cases in NYC, 1,430 hospitalizations, 189 deaths. So this is Jake. I'd gotten this call from the OR. We're almost out of gowns and we can't do any surgeries without them. Can you get us more stat? During the crisis, Memorial Sloan Kettering had to perform more than 50 vital surgeries per day. I'd been on the phone all morning calling other local hospitals. Hey, it's Jake at Sloan Kettering. Do you have any surgical gowns to spare? New York Presbyterian. No, can't do it. SUNY Downstate. Sorry, we're almost out ourselves. NYU Langone. I was going to call you to ask you the same thing. While all that was going on, a friend from pathology called. Do we have a plan if we run out of body bags? My boss ordered us a bunch of contractor bags, just in case. That same day, the NYC Department of Health called asking if we were going to need a body collection point. A body collection point is a refrigerated truck. That's how bad things were getting in the city. If you remember, a number of hospitals had multiple trucks parked right outside filled with dead bodies. But our head of facilities said if it came down to it, he'd rather convert the hospital's unused refrigerated rooms and labs into temporary morgues. Dead people need to be indoors. Anyway, the truck wouldn't have fit in our loading dock, so we said no. To top it off, that same day, the chief attending doctor in the intensive care ward called. I've got a COVID cancer patient who has ripped out his chemotherapy port. The patient was spraying blood and virus all over the room. The patient died in that room. They needed pappers because a team had to go in and clean it all up. I had to arrange it. But right around then, I got a call about the surgical gown issue. It was the hospital for special surgery, and they had an offer. All we have are bunny suits, painter bunny suits. A bunny suit is a clean room suit, like an all-in-one coverall. So there on the left, we see surgical gown. On the right, a bunny suit. And painter bunny suits are all white. I didn't have time to make more phone calls and arrange for someone else to do it, so I went to get them myself. Anyway, HSS is only about 10 blocks away. They gave me 100 larges and 100 extra larges of the bunny suits. On the way back, I ran into one of the MSK security guards out on his lunch break. I'm like, listen, can you escort me back so I don't get robbed? I'd rather be walking around with $1,000 in my pocket than all this PPE. Ha! I dropped the boxes off in the peri-op nursing office. Sure, bunny suits aren't optimal for surgery, but at least MSK could now perform those life-saving operations. As Jake's mentor used to say, done is better than perfect. Anyway, as a hospital, we were really lucky. We never did run out of body bags or need a refrigerated truck. Our morgue holds 21 bodies. The fullest it ever got was 14 or 15. So you say that was your worst day, but it seems like the worst was avoided. As far as I'm concerned, you performed heroically. I don't like the word hero. You see those pictures of nurses whose faces are bleeding because they wear masks all day and they can't go home and hug their kids? Those are heroes. I just sit in an office all day. The end. So that was a piece I did during COVID. And for the last piece that I want to share with you guys, this is a piece I just finished last fall, and it's about Kansas City, a place a lot of you know well, and health inequity. I did this for Harvard Public Health Magazine. It's called Kansas City and the Case for Restitutional Medicine. And again, just want to point out, this is what it looked like in the magazine and online. So you can see, again, how the panels all relate to each other, especially because there's some interesting and unusual panel linkages here, as you can see. So when I put it together panel by panel, it was a little bit of a funny looking puzzle, but let's try to go through it. Kansas City, Missouri, the 3rd District, present day. All too often, the health of a neighborhood mirrors the health of its residents. Brianna Parks Shaw, Kansas City council member and co-chair of the city's health commission. In Kansas City, there are 18-year disparities in life expectancy between one zip code and another. The core cause of that is systemic racism, starting with redlining and other policies created to segregate people. This is what motivated me to run for office. On June 19th, 2021, the first official Juneteenth national holiday, Kansas City Mayor Quinton Lucas joined 10 other U.S. mayors to affirm his commitment to paying reparations for slavery. This is a conversation about how we can right the historical wrongs. What are reparations? There are many approaches, but most people agree that the reparations process starts with taking responsibility, acknowledgement, redress, closure. Justice Gatson, community activist and leader of Kansas City's Real Justice Network. Reparations is about repairing the harm that was caused during chattel slavery. Black people were not unharmed because emancipation happened or Juneteenth, and a real apology is needed to correct the harm. Reparations, or restorative justice, is also not about individual guilt. It is about governmental and institutional culpability for slavery, Jim Crow, separate but unequal, and the long list of harms that have followed. The More Coalition meant the leaders of such big cities as Los Angeles, Denver, Sacramento, and Kansas City were pledging to make good to those harmed by slavery and institutional racism. I think more than anything, we can say we did wrong and we can do better. Cities are still working out details, but the goal is to model different approaches which could give shape to a national response. As for Kansas City, Mayor Lucas imagines a programmatic series of investments rather than everybody Black in America getting a $3,000 check. So can reparations be connected to health? The answer is yes. For one thing, numerous studies show that disease and death rates are elevated for marginalized racial and ethnic groups. It's well established that there are health costs to just being Black in America. In a 2021 paper published in Frontiers in Public Health, the authors state, when adjusting for other socio-demographic factors, being Black is independently associated with increased incidence of a variety of health conditions. Research shows that they are not due to innate biological differences, but rather influences of chronic and unremitting stress caused by racism. Compounding the issue, our country's history of racist medical practice is long and calamitous, including pernicious ideas such as Black people having a higher tolerance for pain, more resistant to certain diseases, not to mention being forced into experiments during slavery. Or you talk about Henrietta Lacks and what her cells did for medical research, and yet her own family was denied what her cells did. You can't just ignore all the things that have happened to the bodies of Black people for research. It has a big part to play in restitution. The state of Missouri has third world numbers in terms of maternal mortality and infant mortality. In Missouri, Black women are 3 times as likely as white women to fall victim to maternal mortality, and there's double the amount of infant mortality compared to white babies. The systems in place are what create this disparity. Why Kansas City needs reparations. Residential segregation is considered the primary factor that influences health outcomes. So we see Kansas City, Missouri, total population 508,000, Black population 152,000, which is about 30% of the total. In Kansas City's Black neighborhoods, this plays out in concentrated poverty, poor quality housing, endemic violence, and second-rate medical care. Here we have Brianna Park Shaw again. In my district, there's limited access to healthy fruits and vegetables. There's an overabundance of liquor stores, convenience stores, and dollar stores. In the 1930s, in an attempt to shore up the country's troubled housing/mortgage market, a federal agency drew up maps of hundreds of US cities that divided neighborhoods into 4 types of zones. See here, it's A for the best, B for still desirable, C for definitely declining, and D, hazardous. In Kansas City, most Black neighborhoods were classified as D, hazardous. The result was a city that was virtually split in half along Troost Avenue. Residential segregation worsened after 1954's Brown versus Board of Education Supreme Court decision sparked white flight to the KC suburbs. The subsequent construction of the US 71 connector similarly divided the city. Here we see Mickey Dean, retired civil servant and member of the Kansas City Reparations Coalition. They cut a swath right in the middle of the Black community and displaced all of those folks. Some studies show that the areas of KC that was designated as A, best, now produce 11 times more wealth than the redlined areas. And that's just measuring things from a contemporary perspective. This inequity now goes back more than 8 decades. Remember Councilwoman Park Shaw's comments about life expectancy by zip code? Let's compare 2 regions within Kansas City. On the left, we have zip code 64113. Population 93% white, average home value $305,000, average life expectancy 86.3 years, which is the city's highest. Over in zip code 64128, population 86% black, the average home value is $50,000, and the average life expectancy is 68.1 years. It's the city's lowest. So looking at the 2 zip codes, it's apparent that Black-owned homes are worth roughly 16% of white-owned residences. But much more troubling is the 18-year difference in expected lifespans in those 2 areas. And that gap is actually getting worse. This is within the same city. The other component, Rihanna Parkshaw again, the other component is violence in the communities. Gun violence, homicides. Appropriating dollars for violence prevention could be huge. There are previous examples of reparation-style health programs in the US. For instance, the community health center model is facilitated by Jack Geiger, MD. Another example is from the late 1960s. The Black Panther Party created an inner-city school breakfast program which spread to cities nationwide and later expanded to include community health care, ambulance services, and legal assistance. Sometimes planning for a healthier future means starting with something already in place. Uzazi Village, located in KC's urban core, was founded by Hakima Tafunzi Payne in 2012 as a place to provide doula training and has since expanded to become a true maternity clinic. Uzazi also offers classes, support groups, including the Chocolate Milk Cafe for Black breastfeeding mothers, and more. Here's Ms. Payne. It's a clinic model that's specifically geared towards the way Black women would do Black prenatal care if we asked them, because I did. Community-run nonprofits like Uzazi Village could be models for the future of reparative health in Kansas City. If we can make it work for the group that has the worst outcomes, then it will work for everybody else. Mayor Lucas has been meeting with community leaders, including Gadsden, on how to implement Kansas City's reparations program. How do I put this package together? How do I disperse it? And here's Justice Gadsden again. If we have this coalition together by the fall, I will feel like our mayor is very sincere. I don't think he's stringing us along, because if he is, a lot of groups will come for him. One hopeful sign for reparations happened this past summer when the city won a $5 million grant to plan ways to restore Black neighborhoods severed by Highway 71. Mayor Lucas, you can't go back to the past, but you can try to do better. That may not seem directly related to restitutional medicine, but healing a broken community sparks the imagination. We know what we need, but there's a huge gap. Reparations are in order. Never the end. So that is my presentation of my work. And I hope you guys got a sense of the different ways that nonfiction comics can be expressed and some of the ways that I've used them over my career. I see there's a question in the chat, which is, do I get people's permission to portray them as comics characters? Yes, so if anyone is going to be in one of my comics, I approach them just like a regular journalist and I interview them. I record our conversations. I make transcripts of our interviews. and I let them know who I am and what I'm planning on doing. And I often give them links to see some of my other work, so they kind of have a sense of what I would, the kind of style that I work in. They can see that I'm not someone who does caricatures or political cartoons, and I'm not trying to ambush anybody or, make them into some kind of horrible caricature, but that really I'm there to tell their story. So yeah, anybody in any of the pieces that I showed that gave me prior permission to tell their story in comics form. And I see another question here. How much research do you do for articles like the one on Kansas City? How do you keep your notes? And what's your process for condensing for the comics format? Well, funny you ask. I happen to have some more slides where I can talk a little bit about my process. Diane, does that seem like a good idea? I can show a few of those. All right. So let's talk about my process. So the process of making a comic is not a short one, at least not for the type of comics I do. This is sort of an overview of what a typical comics process is. Sometimes people skip a number of steps here or there, but basically you start out with a script, you thumbnail or rough out your layout for your page, then you roughly pencil in, and then you tighten the pencils and get all the detail in there, and you put your lettering in, then you start inking, and then there's the spotting of the blacks to create a sense of graphic movement and drama and a sense of lighting. And then, of course, there's further steps like coloring and making corrections. So in my particular process, I start with research. This was for a piece I did about, it was called The Tale of Two Pandemics, and it was about comparing the way the pandemic affected African-American communities in 2020 or COVID-19 versus the so-called Spanish flu 100 years earlier. And this was based on an article that was written by these three doctors in the Annals of Internal Medicine called Historical Insights on Coronavirus Disease 2019, the 1918 Influenza Pandemic, and Racial Disparities, Illuminating a Path Forward. So I read their article, and I kept lots of notes, and then I also interviewed them by Zoom, and furthered what was in the original article so that I could make it feel a little bit more immediate and connect more directly, so that we could see these people who had written the story. So these are their, just to remind you, these are the real people who were the authors of the piece. I did more research, especially connected to death and race, and there was a lot of ideas, especially early on in the COVID-19 pandemic, of this idea of Black immunity, that African-American people were under the impression that they were not as susceptible to COVID-19 as other people. And this was actually a myth that was spreading around in social media and was very detrimental to people's health, obviously. But it was based on these previous myths of the same kind. So anyway, once I did all that research and interviews and so on, I created a script, which I share with my editor, who gives me feedback. In the script, as you can see here, I describe each panel, what's going to happen in each panel, if there's any captions, my narration versus the character speaking. It sort of looks like a script from a play or a movie. And so here you can see the highlighted portion in blue is what ends up going into is what I end up illustrating. Then I do my character design. So these are the women as they originally appeared in the photographs, and then this is what they look like as comics characters. And just to show you sort of like an example for the piece I just showed you, sort of the process that I'm working with. I work digitally now. I used to work traditionally, but 2 or 3 years ago, I started moving over to digital production. So in the layout stage, what I do is I actually take the information that I wrote in the script, and I just pop it into the panel. So you can see here, it's a speculative future imagination of the same Kansas City street corner from the opening, but now part of a reinvigorated community. The liquor store has been replaced by a maternal health clinic, a green market, sidewalks, and happy people on the streets, even smiling at the reader. You can see that I already have some stuff sketched in there, and I knew that I had this inset panel. That's that panel that's in a circle over on the right-hand side with that quote from Justice Gatson, again, direct quote of hers. So that's the layout of a thumbnail stage. And then this is what it looked like when it was in pencil form. Pretty rough pencil, but that's now the scene that I described in the script. And then this is what it looked like when it was inked. And then this is what it looked like when it was colored. Actually, I do a little game where I ask people if they can spot the differences, because there were a few things that I changed right at the very end to update the, to make the scene, to remind folks that this is sort of an imaginative scene, like didn't actually exist. It's sort of what we're hoping for the future. So you can see from the coloring treatment, the black lines in the main panel are now like a dark blue to kind of give it a more of a, almost like a dreamlike feel. And the borders of the panels, the corners are now, instead of being square, they're rounded off, because that's a sort of traditional indicator to people who've read a lot of comics that this is like an imaginary scene. So this is kind of like what we would look for in a reinvigorated community. So that's sort of the process for doing the art. And in terms of reference, I use tons and tons of reference. So here at the beginning of that, this is the Tale of Two Pandemics scene. This was a scene where Idris Elba, if you all remember the actor Idris Elba, he got COVID very early on, and he recorded a video on Twitter where he told people, listen, Black people can get this disease, make sure to protect yourself, wear masks, don't be stupid. So I portrayed that scene in the comic. And these are other characters, real life people who appeared in the story. And, obviously I try to do as much visual and photographic reference as I can as I'm drawing them, even down to characters who are kind of like appearing in the backgrounds of other scenes. Here I was actually taking real tweets and Facebook posts from earlier on during the initial phase of the pandemic and replicating them in the comic. So you can see I really try to get as much information as I possibly can that's accurate and purposeful, because I feel like the reader relates to that. The reader feels and trusts me as a storyteller if they feel like there's some verisimilitude to the work that they're looking at. So here I even, for this image of an African-American newspaper from the days of the pandemic, I got reference for their logo. These pictures of the Tuskegee experiments I used as reference, and so on and so forth. One of the things that you can do in comics is also you can give impact to dry statistics. This was a statistic about how many African Americans had died from COVID. At this point, it was at a rate of almost 2.5 times more than their white counterparts. So I tried to give this graph a little bit more visual dynamism and give it some more impact. Another piece that was sort of like that is another story I did called Vaccinated at the Ball, which was about LGBTQ communities in Chicago and their vaccination rates. So I tried to think of different ways to kind of make the statistic look a little more lively. And I was thinking, like, how can I take a chart and also use like a vaccine or the Sears Tower, kind of just like brainstorm different ideas. I finally came up with this vaccine needle, which showed the percentage of Black residents in Chicago's population, the percentage who had received their first shot, and then showed it as a needle. And I thought that was a way of, again, just bringing something that's overly familiar and maybe making it feel a little fresh and unusual. I also use color as a narrative tool in a lot of my comics. You'll see, just as a way to remind people of what they should be paying attention to. So in this case, the pale blue is my voice as the narrator. So anytime you see a caption that's in that pale blue, that's to point out that that's me speaking, or the narrator speaking. Whereas whenever there's a balloon or something in yellow, that's that's actually from one of my interviews or their own writings, and it's a very verbatim quote. And then I used red in that comic as a trigger for the reader to notice something or to pay attention or to see that this was something that should be not taken at face value, like social media platforms and disinformation. Let's see, I've got some other questions here. This is one from Stephen Herrick. You've spoken and written about your comics influences: Hergé, Neil Adams, John Byrne, Frank Miller, George Perez, Matt Groening. And the list of nonfiction comics presumably includes some comics that you've read and appreciated. What current or recent comics creators are impressing, driving, or inspiring you? Fiction, nonfiction? Good question. Well, I always have to talk about like the nonfiction comics that were very inspirational and influential to me, that I think are like evergreen, and if you haven't read them, that you should start off with them. So one of the ones I always talk about is Scott McCloud's Understanding Comics, which is a graphic novel. It's a comic about comics and how they work in the form of a comic, and it's really influenced the way people talk about comics ever since it came out 30 years ago. Must read, even if you don't agree with it. And Mouse by Art Spiegelman is a really important one. I think a lot of people are familiar with, as is Persepolis by Marjane Satrapi, about growing up in the Iranian Revolution and dealing with her own development as a girl and then a teenager and a young woman while in this newly autocratic society. There's Fun Home by Alison Bechdel, amazing memoir about a girl's relationship with her father and discovering her own sexuality and her finding truths about her father. Really powerful piece. And then there's the March trilogy by John Lewis, Andrew Aiden, and Nate Powell, about the civil rights movement and John Lewis's journey. And I always have to talk about Safe Area Garage by Joe Sacco. He was one of my biggest influences as a comics journalist, and he's done almost all of his books are comics journalism, and they're amazing. Other books I like to talk about are Viet in America by G.B. Tran, about a Vietnamese American kind of discovering his roots. Blankets by Craig Thompson. Good Talk by Mira Jacob, really great, amazing book that's also done mostly using photographs and clip art, and a really cool example of that, being able to make comics if you're not necessarily a natural artist. And My Friend Dahmer by Dirk Backdorf, about Jeffrey Dahmer by a former schoolmate of his. And a book I really like that is called fiction, but it's really nonfiction. It's called A Drifting Life by Yoshihiro Tatsumi, Japanese cartoonist who had a long career and basically documents his life as a youngster who became a fan of manga and then decided to become a manga artist, and like what it was like in that era of the beginning of the manga industry, and wanting to make manga or Japanese comics that really were meaningful. And some new books that have just come out include Invisible Wounds by Jess Rolifson, Going Remote by Adam Bessie and Peter Glanting, Just Another Meat-Eating Dirtbag by Michael Anthony and Chai Simone, Thing by Sam Machado and Cynthia Sousa Machado, Come Home Indio by Jim Terry, and Crash Course, If You Want to Get Away with Murder, Buy a Car by Woodrow Phoenix. Those are all books that have either just come out or will be coming out soon, that are all nonfiction, that are, I think, really worth checking out. So got a couple more questions here. What am I working on now? So I am about to do a new piece for Journalist Resource, who's the organization I've been working with a lot recently, doing some of the pieces that you've seen that I showed you here. And this is going to be on empathy, and particularly like doctors and medical school and empathy. Like, how it is. There's studies that seem to show that doctors, medical students, empathy levels go down the further that they advance as doctors. So that's not a good thing. And we all want to have doctors and medical personnel who feel our pain and understand it and can relate to us and talk to us about it in an empathetic way. So there are various methods that are being tried in medical schools to try to increase empathy and create more connection between patients and caregivers. And so the piece is going to be on some of the techniques that are being used, which I think is going to be really fun. So I'm working on that now. And I think we're pretty close to the end. But oh, what do you think is a good gateway comic for someone who doesn't think they will like comics? That's a great question. I mean, a lot of the comics, the graphic novels that I mentioned before, I think are good gateways, but it really depends on kind of like what your expectations are. Like, if you liked comics as a kid, but then you felt that they were, you know, too childish or only for children, maybe, you know, go back and find a graphic novel or a comic that is on a topic that you know is an adult one. There's so many graphic novels out there now, so many comics for all age levels. They're in different art styles. You know, look for an art style that looks appealing to you, for a voice or for you know, a spirit to the book that just looks appealing and interesting, and you'll probably find yourself absorbed and learning something or enjoying something in a way that you found unexpected. And then that's the gateway. All you need to do is find that one comic that'll sort of rearrange your expectations of what comics can or can't be, and then the next thing you know, you'll be at the library, you know, taking out 10 books at a time. So yeah, I'm a big proponent of a high tide rises all boats. Is that the phrase? But yeah, Viva Comics.
Well, I think that's about all the questions we have. Thank you, Josh, so much. It was so informative and fascinating and quite frankly fun. I may have laughed out loud a few times. So thank you so much for being with us. And I want to thank everyone in the audience for being with us this evening. And we are very fortunate to have Josh for 2 more programs this week. Tomorrow, and they will both be on Zoom. Tomorrow night will be Writing for Comics. And Saturday morning, Josh will be leading a workshop on how to draw a successful comic. And you can find information about these programs and other library programs and writing programs at jocolibrary.org/events. And you can also find resources for writers at, again, jocolibrary.org. We recommend for writers. And thank you all for joining us, and enjoy the rest of your evening.
Thank you. See some of you tomorrow.